Hello and welcome to the St. Francis Healthcare Weight Loss Seminar. Today, you will be learning what obesity is, who is a candidate for bariatric surgery, the different types of bariatric procedures, and the next steps to prepare for surgery. Here at St. Francis, we have a multitude of different medical professionals involved in getting you prepared for bariatric surgery. We utilize registered dietitians, nurses, psychologists, and nurse practitioners, as well as board-certified bariatric surgeons. What is obesity? Obesity is defined as a disease of excess energy stores in the form of fat. Obesity is a chronic disease. It can stem from many causes, and in some cases can alter the span or quality of one's life. Obesity is usually measured using body mass index, or BMI. Obesity rates in the U.S. have more than doubled in the past 20 years. About 40% of adults are obese, affecting about 93 million adults. 18.5% of children are obese, equating to around 13.7 million children. The prevalence of obesity in Tennessee is currently 38%. Obesity is a complex disease. There are so many factors that can affect weight. Some factors involved are genetics, hormones, health behaviors, your environment, and your metabolism. Health risks. Being overweight or obese can have a significant impact on health. Carrying extra weight leads to serious health consequences such as cardiovascular disease, type 2 diabetes, musculoskeletal disorders like osteoarthritis, and some cancers. These conditions can cause premature death and/or substantial disability. Who is a candidate for bariatric surgery? Patients must be at least 18 years of age, have a BMI of 35 with chronic medical conditions, or a BMI of 40 with or without medical conditions. To be eligible, you have to have multiple failed weight loss attempts in the past, understand the surgery procedures, risks and benefits, and be ready to commit to diet and lifestyle changes. You must also be a non-smoker and not partake in substance abuse. Who is not a candidate for bariatric surgery? Patients who use non-prescribed medications, patients with uncontrolled psychological disorders, patients with an untreated history of eating disorders, patients with portal hypertension, and smokers are not candidates for bariatric surgery. Some disqualifying factors for surgery include extremes of age, having a BMI less than 35, and pregnancy. Here are the different types of bariatric surgery. Our three types of bariatric surgery are gastric bypass, sleeve gastrectomy, and revisions of gastric bypass and sleeve gastrectomy. The sleeve gastrectomy is a surgical weight loss procedure that involves removing about 80 to 85% of the stomach, leaving a tube-shaped stomach about the size and shape of a banana. This procedure is also called a vertical sleeve gastrectomy. It helps to limit the size of your stomach, restricting the amount of food you can consume. In addition, the procedure prompts hormonal changes that assist with weight loss. The typical hospital stay for this surgery is 1 night. It is a permanent restrictive procedure with an average of 60% of a patient's excess weight being lost after surgery. Gastric bypass, also called Roux-en-Y gastric bypass, is a type of weight loss surgery that involves creating a small pouch from the stomach and connecting the newly created pouch directly to the small intestine. Swallowed food goes into this small pouch of stomach and then directly into the small intestine, thereby bypassing most of your stomach and the first section of your small intestine. The gastric bypass is ideal for patients with type 2 diabetes or gastric reflux. This procedure is restrictive and malabsorptive. The typical hospital stay for this procedure is 1 to 2 nights. Patients can expect to see 75% of excess weight lost. Some potential risks after bariatric surgery are listed here. Some potential risks are constipation, diarrhea, vitamin deficiencies, and excessive weight loss. It is advised that patients continue seeing their bariatric surgeon and care team after surgery to help mitigate these risks. Other considerations. You must be nicotine-free for at least 6 weeks prior to surgery and for life after surgery. This includes cigarettes, cigars, chewing tobacco, pipes, electronic cigarettes, and marijuana. Some patients may experience hair thinning and have excess skin after surgery. These are some nutrition goals for bariatric surgery. It is advised to establish nutrition goals, increase exercise as tolerated, drink more water and liquid, and avoid carbonated beverages. Plan out meals and snacks and start measuring portion sizes. Patients see more long-term success if they limit grazing or unscheduled snacking and work on eating slowly. What's next? Call the number to schedule a consultation with a bariatric surgeon. Our office will help verify insurance benefits and help you with the next steps for bariatric surgery. Feel free to reach out with any questions you may have. Thank you for attending this seminar and have a great day.